Hello everybody and welcome to another show of Eyecare Today. I'm your host, Dr. Thomas Kislan, and today I'm joined again by Dr. James Deom, who you've all grown to know and love here in Hazleton and Stroudsburg. He's been with our practice, what now, about 2 years?
Yeah, going on three now, yeah.
Going on three.
Yeah.
Wow, time flies when you're having fun.
Yeah, that's right.
So again, if there's any questions, comments, please feel free to reach out to us. Our Hazleton location is on the Beltway in Hazleton, 570-453-2020. And for those of you watching in the Poconos, we can be reached at our Stroudsburg location, Stroudsburg Eye Specialists, 570-421-3342. And as always, check out our website, www.drkislan.com. So again, Dr. Deom, thanks for joining us. Dr. Deom, for those of you who don't know, just is freshly back from running his third Ironman triathlon.
That's right.
Correct? So he was actually running down the street and I grabbed him to come in and do a show today.
Luckily I wore my tie and shirt today.
Right, so congratulations on that. I know
Thank
that's a great feat. So
Thank
if you
you.
come in and see Dr. Deom, you can talk about his running qualities and everything.
Yeah.
So congratulations on that.
Thank you so much.
What we're going to talk about today, in our last show that we did, we talked about glaucoma. This show, we want to talk about another condition that affects close to 3 million people in the United States, and that is macular degeneration. So Dr. Deom, why don't you tell the folks out there a little bit about what macular degeneration actually is?
Thank you so much, and this is a really just a condition I think is close to both of our hearts, and the reason that is because we're both from this area, care a lot and are very passionate about the people in this area, and the people in this area I think disproportionately suffer from macular degeneration, and the reason that is because macular degeneration affects people over the age of 65.
Which we have a lot of in this area.
Whites.
A lot.
And females.
A lot.
Also a lot.
And also kind of Irish descent.
Yeah, and so, you know, we see a large population of these individuals, not to say that it doesn't affect other populations, also very much a condition that affects our Latino and Hispanic population as well. So still a big issue, you know, even with our changing demographics in our area. But, you know, this is a condition that will affect white females over the age of 65 more than any other demographic. And so what I always tell people is these are things, you know, especially if we're in our 40s or 50s, and we have a family history of macular degeneration, because we do know that there's some genetic components to this, that we need to get you in soon so we can do some early evaluation and maybe recommend some vitamin supplementation, which I know we're going to get into. But what is it? What is macular degeneration, right? So what do we see?
Well, you know, the first question is what does the patient see?
Right.
And I think, you know, some of the first symptoms for patients is kind of a blurring or distortion of their vision.
Right.
And again, you know, here's a condition where patients may think they need glasses.
Right.
And again, we talk about our patients in their 60s maybe, and again, we'll see patients who never wore glasses their whole life. All of a sudden, they're not seeing clearly and say, well, I probably just need glasses because I'm getting a little bit older. They come in and you know what? It just ain't a glasses thing.
That's right.
You know, and again, we talked about this in the last show. If you're out there watching and you've never had your eyes examined, you need to get your eyes examined, because there's conditions out there when caught early, like macular degeneration, that we can possibly do something for. So just to go back a little bit to the original question, what happens, patients will come in and they start to get some blurring of vision, and it's actually where the retina or the back of the eye, and our little eye model here, just to give patients an idea, if you think back to what an old-time camera worked, light comes into the front of the eye, it's focused through the cornea, through the lens, onto the retina, which is the back of the eye, and that retina is kind of the film in the camera that develops the picture. So that retina just starts to degenerate away or not work as good as it used to. Is that kind of how you would explain
Absolutely. It? And you know, I think, you know, you mentioned, you know, the blurring of vision, and you know, that even is going to be more present in a moderate to advanced stage of glaucoma already. So hopefully we can get you in sooner and see you more in the mild stages, or if you know that your family has a macular degeneration in your family, we're watching you. Some of the early stages are little white flecks or fluffy little dots in the back of people's eyes and their retina. The way I always describe it to people is that we as humans create and dispose of waste. we create and dispose waste. The eye as well creates waste.
All tissues in the body.
Everything does, yeah. That's your muscles, you build up lactic acid, you feel cramps, things like that. So in your eye and everywhere else, you create waste. And so the eye's waste is this fluffy white material called drusen. And so that should be gotten rid of by the eye, but in some individuals, they cannot get rid of it. And we see it build up. And so when we see this drusen start to build up, that is a sign that we need to watch them a little bit closer and that they are at risk for getting more advanced stages of glaucoma. Macular degeneration.
Exactly, and just to reiterate, these little white spots are not spots patients see. So it's not like they see white spots in their vision.
Right.
It's something that when we look into the eye, so again, these patients come in for an eye exam, which they haven't had in 20 years, and we look inside the eye. When we look in the retina, we can see these little spots. And again, we talked in the last show about the great technology we have at Hazleton and Stroudsburg Eye Specialists. We can take a picture, a digital retinal image of the back of the eye and show these patients these little tiny spots in the back of the eye. And the great thing about the digital imaging is we can save it and compare it year to year.
Right, and I think that's such a powerful tool, and also to show we have some stock photos of what it looks like with mild, moderate, and advanced forms of macular degeneration. We could say, this is where you are, this is where some other forms can be, and what to expect with that. But again, kind of like the glaucoma thing, early stages, there's just signs. In other words, what we see, not what you see. So it's so important. If you have a family history, if you're a white female, if you're in the white demographic at all, you've not had an eye exam and you're approaching 65, you need to get an eye exam.
If you smoke.
It's huge. Smoking increases your risk of macular degeneration by 20 times. 20 times. It's really unbelievable.
And not just the onset, but if you have macular degeneration, you smoke, the progression of macular degeneration is so much, the chance of it progressing is so much higher in patients who smoke. And we'll probably touch on that a little bit more in the next segment about smoking, but that is really a biggie. So like you said, there's a lot of factors that go into macular degeneration, which we're going to get to in the next segment. So we're actually going to take a quick break here. Again, you're watching Eyecare Today, and we'll be right back. Welcome back, everyone. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan. Joined today with me is Dr. James Deom, and we're coming to you from our Hazleton location, Hazleton Eye Specialists on the Beltway in Hazleton. Our phone number 570-453-2020, and our Stroudsburg location, Stroudsburg Eye Specialists, 852 North 9th Street out in Stroudsburg. The phone number is 570-421-3342. As always, check out our website, www.drkislan.com. So, Dr. Deom, last segment we were talking a little bit about another condition that affects close to 3 million people in the United States, a lot of patients in our area here, and that is macular degeneration. So, real brief, just kind of explain again to the folks who's at risk for macular degeneration, kind of what it is.
Again, macular degeneration affects disproportionately individuals, Caucasian whites, females more than males, and people actually over the age of 65, and even to a higher degree, people over the age of 80. We know that if you're over those ages, that you have a much higher risk of getting it, and if you fit into those demographics, you have a much higher risk of getting it. Also, if you have a positive family history, in other words, somebody in your bloodline has had it previously. If any of those things are true for you, you should be getting a regular eye exam where your retina is being thoroughly evaluated. We said that it's a condition that affects your central vision. Your macula, which is the area right in the middle of your eye. And the earliest thing we see is the deposition of this material called drusen. And that really kind of segues into our next thing that we wanted to discuss is when we see this drusen, that is the beginning of what we call dry macular degeneration. So can you explain, the difference between the different types of macular degeneration?
So we have what's called dry macular degeneration, which is the most common form of macular degeneration. It affects the most patients out there. And then we have what's called wet macular degeneration. And they're very different. the treatments or what can be done for them are very different. So in a nutshell, dry macular degeneration is where this drusen that we see continues to deposit. The retina slowly kind of just starts to degenerate away, and there's really not much to do except some vitamin supplements. And you know, the patients out there watching, or the folks out there watching, have heard us talk a lot in the past about nutritional supplementation. We're really big in this office with the physician recommended nutraceuticals, and there's basically two options, and it depends on the form of macular degeneration and where you're at as far as which one we might recommend. But there's an omega-3 supplement, which you can see here on my left, your right out there, for those watching on TV, which is an omega-3 with lutein, zeaxanthin, and vitamin D3. And this product was actually developed by Will's Eye down in Philadelphia. It's a product that has been shown to really help prevent some progression of a little bit of the dry form of macular degeneration, but just a healthier option as far as keeping the eye nice and healthy. And then on the right, on my right, we have what's called macular vitamin benefits, which is more of an antioxidant supplement. Can you tell the people out there watching what antioxidants are?
Yeah, so you know, again, when the body is working and is stressed and it is doing functions of seeing or doing, it oxidizes. Okay, it produces these negative things in our body, and that is the process of oxidization. And you know, these supplements and vitamins have been shown to help reduce that and take away some of that stress that the body is producing. And so, you know, that will hopefully reduce some of the negative, what we believe to be causative factors in macular degeneration. And, you know, this macular vitamin has been studied extensively. I think that's really important. I always talk about the AREDS study with people, age-related eye disease study. Big study. There was two different ones done. So most of the vitamins out there are AREDS 2, which have a mixture of these antioxidants plus lutein and zeaxanthin. I always tell people, eat as many dark green leafy vegetables as you can. You know, get out and exercise 3 days a week if you can. Walk 20-30 minutes. Protect your eyes from the sun. Sunglasses and a brimmed hat. But we definitely want to make sure we're taking our antioxidant supplements.
I think the one mistake, though, patients make is they hear out there, you know, AREDS 2 and these are good, and then everyone goes to the pharmacy and buys this stuff. The problem is it was studied only in patients with advanced macular degeneration. So it really has been shown to do nothing in patients with the early stage. So I'll have patients that come in, and the joke I make that is in the United States we have the most expensive urine of any country in the world because we take all these supplements that really our body doesn't need, or there's been no evidence-based medicine to show it actually helps. And that's why, you know, we're here for you, because we can guide patients, you know, because there's certain forms or certain points in macular degeneration you should be on this. There's certain points in macular degeneration you should be on this, and there are certain ones where maybe you should be on both. Right. And that's why, you know, it's important that you come in and talk to us, because we can guide you out there as far as what is the best thing out there, because not everything that's sold over the counter is really good for you.
In fact, a lot of it's garbage.
Right.
And be just honest, you know, right. A lot of it's garbage.
It's, you know, the vitamin supplements out there are not governed by the FDA. So there's really no regulation. They can say and do anything unless you have some providers out there who understand nutraceuticals and what vitamins do. It can be very confusing Absolutely. For patients out there. And you're right, a lot of the stuff out there on the shelves is just garbage. The body doesn't absorb it and use it really well. It's excreted into our urine and we just kind of pee it away. And so we want something that the body's going to use, it's going to help. And like you said, sometimes it's just as simple as eating some green leafy vegetables, exercising, not smoking, protecting your eyes from the sun. And you made some great points before. Just again, tell folks out there the problem with smoking.
You know, smoking, again, puts extra stress on our body. So much of what we found out about macular degeneration has to do with these, stressing and poor health, and so on. And so what does smoking do? It creates a stressful environment for the blood vessels and the blood in our body and throughout our body. And the eye is just an extremely blood-rich area. And we're sending these negative toxins through our blood into our eye, which is creating an inflammatory situation. And we think that macular degeneration really at its heart is an inflammatory condition. And so 20 times increased risk. So, the number one thing I always ask people is, if you're having macular degeneration, do you smoke? If you do, we really need to talk about quitting.
Yeah, that's very important. So please, if you're out there and you smoke, really consider stopping smoking. It's just going to be better for you in the long run. So we're going to take a quick break. We're going to come back in our last segment and talk more about really how we diagnose and follow macular degeneration and what the treatments are. So again, you're watching Eyecare Today, and we'll be right back. Welcome back, everybody. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan. Joined with me today is Dr. James Deom, and we're coming to you from our Hazleton location on the Beltway in Hazleton, 570-453-2020. And for those watching in Stroudsburg, 570-421-3342. As always, check out our web, www.drkislan.com. So macular degeneration is what we've been talking about for the last two segments. Real briefly, we mentioned about how bad smoking is, not just in general, but for macular degeneration. And again, why is it that bad?
One thing I think about is I have some friends who are primary care doctors, and they talk to me about, discussing smoking with patients, how tough that discussion is. A lot of these patients have been smoking for 20, 30 years. A lot of these patients have been told by all their providers to stop smoking. But I think, the conversation that we have with patients is quite strong. And I've seen, in my short time in practice here, several patients stop smoking because macular degeneration can and will cause blindness if left untreated, and your risk is increased by 20 times. There's been quality of life studies done that show people would rather give 5 years of their life than go blind. Blindness is scary, and if we have some way of reducing the risk of blindness, that being stop smoking, patients often listen to that. So it's our job, and we do it, to discuss that with people. It's a tough discussion, but...
Right. For me, the two toughest discussions I have, one is diabetes and controlling blood sugar, which is a whole other show, and blindness from diabetes. But the risk factor with smoking and blindness with macular degeneration is just off the charts. So we're going to move away from that for now, because I think we've harped on enough. But if you're out there and you smoke, please stop. Because what can happen is when macular degeneration progresses, it goes into the wet form of macular degeneration. What we've been talking about is the dry form, which some nutraceuticals help for, but the wet form is where you have bleeding inside the eye. So the blood vessels, you talked about the blood vessels in the eye, how fragile they are, they actually leak blood and fluid. So what happens in our patients when that's going on?
I'll try and be brief, but again, going back to the drusen, there's several layers of the retina, okay? And so in the outer layer of the retina, and we'll show a picture here, the outer layer of the retina is where the blood feeds the inner layer. This drusen builds up in between these two layers, and then the retina cannot get the blood that it needs because there's this layer of drusen in between the nutrient blood rich area and the area that needs the blood. So what happens? The retina is very smart. It says we need blood, we need to make new blood vessels, neovascularization, new blood vessels. These new blood vessels grow. However, new blood vessels are always bad, never good. They're weak and they break and they bleed, causing almost immediate vision loss. I'm sure you've seen patients come in an acute situation and say, you know what, I have a black spot right in the middle of my vision. Okay.
Right. And when that happens, and the vision that's lost from that, it's very tough to get it back. At that point, we're scrambling. I'm on the phone with Dr. Patel, our retina specialist, getting this patient in the next day, hopefully, for treatment. And it's very difficult at that point to get vision back. We're really trying to prevent more vision loss at that point. So, we do make that call, and then the patient sees Dr. Patel. What do we do then?
The big thing there is, again, and I think you hit on it really, really hard there, is early. If it happens, you see this happening, you're not sure what's happening, call us immediately, even on the weekends or at night. We have an emergency call service, so even on the weekends or at night, if you see something weird like this, you need to call us right away. The sooner you get treatment, the better the outcome. We have patients that unfortunately leave it go, and the longer it sits there, the blood is actually toxic to the retina, it'll kill the retina. So if we can get that taken care of sooner, better. So what happens when Dr. Patel sees the patient is that they may be a candidate for an injection, which is really revolutionary treatment. 5 years ago, we didn't have that. I don't know that. Dr. Kislan would know about that. I'm just kidding. What they did then was they actually lasered the retina.
Right.
That laser would kill the retina.
Right. So it stopped the bleeding, but it also damaged what it was lasering.
That's right.
You know, you did prevent it from getting worse, but you didn't get anything back at all, and sometimes it did get a little worse because you're damaging the underlying tissue. But now the injection actually will help, and it kind of sounds barbaric, injecting medicine into the eye, but that's what has to be done.
And it's important to know that, you know, this is a painless procedure. It's a little bit scary. It's painless. Dr. Patel is extremely skilled at doing this.
He's done
thousands of these, and it's painless. And you know, the goal of, and I think it's very important, the goal of injection therapy is not to, unfortunately, bring back vision. A lot of patients get this confused. It's not to bring back vision. It's to stop it from getting worse. Many times you will get better, but that's not the goal of the therapy. The other thing to know is that the injections will need to be repeated. You know, so it's still not perfect, but it's much better than what we used to have.
A lot of times patients will require a series of 6 to 8 injections over, you know, every 6 to 8 weeks. They
Right.
come back and they will see Dr. Patel, they'll have an injection, and it really requires multiple injections
Right.
to get whatever effect we're trying to get with these patients.
Absolutely.
And then, go ahead.
Yeah. So I was just going to say, you know, the point we want to make really is that we don't want to get you there. We want to stop you before you get there, if at all possible. And a lot of that has to do with the technology that we have in the office.
Right, and you know, we have a couple minutes left, so I just want to briefly touch on some of this technology. To my right here is an instrument called the dark adaptation machine, which we're the only ones in the area to have. Nobody else in this area has this. So briefly, Dr. Deom, what can we test with
I
this?
think, you know, again, I'm really proud to be in this office to have this machine. You know, this is only in large universities and research centers for many years, and it's just being started to introduced into other offices. And so what the purpose of this does is, I always explain to patients is, you know, the retina, when you have macular degeneration, you're actually losing cells in the part of your eye that is sensitive to light. So when you go outside and you see the sun, it washes out your eye, okay? It washes out your eye. You know, if you were to come back inside, it's all dark. It's very difficult to see. The time it takes for you to be able to see after your eye's been washed out by a bright light is a process called dark adaptation. This machine measures that. It shines a big flash of light in your eye, and then it gives darker or lighter, smaller dots, and you click the button. Again, another button clicking machine.
This one's easier though.
This one's better. And it measures the sensitivity of your eye. And so that is a direct correlation to how many cells are living inside your eye.
Yeah, and for those patients out there, again, with macular degeneration, you know, they're usually some of our more senior patients. Just think of it, you got to get up in the middle of the night to go to the bathroom. You turn the light on in your bathroom to go to the bathroom, and you're like, your eyes have to adjust to that. So how fast your eyes adjust to that light and then back to the dark is kind of what we're testing. And if that's not in the normal range, that's a sign that the macular degeneration may be further along than we thought. And that's where we're going to have a serious discussion about exercising, not smoking, nutritional supplementation, eating well, those things that can prevent you from getting to where you need to see Dr. Patel and need the injection. So we need to wrap it up there. That was a lot of information in the half hour. So again, folks, if there's any questions, please contact our office in Hazleton and Stroudsburg. Again, we appreciate you watching. You've been watching Eyecare Today, and we'll see you next time.